What would you answer if I ask you what the biggest danger for the kidney actually is? Maybe diabetes? Or high blood pressure? Or smoking? High cholesterol? Lifestyle choices? And all that? And what about medical errors? What about those issues that are not caused by you, but by your doctor? It's recent news that a 42-year-old veteran reached a record of $10.5 million settlement after the wrong prescription caused him a total renal failure. But how can we make sure you are not facing the same risk? In this video, 5 medical errors that could keep you from improving your kidney function and how to avoid them. Gathering here, I've been helping kidney disease patients taking control of their health for more than a decade now. And despite what many doctors are still telling their patients, we know today that improving is always possible, even in stage 5. But we also know that seeing improvements in CKD patients in the advanced stages is not common. They always say that after a certain point, dialysis is the most likely outcome. But what if the reason why this happens is your doctor's fault? Let's take a look today at some of the most common medical errors, 5 possible dangers you should be aware of so you can avoid them. Number 1. Using the wrong diagnostic tools. In 2008, a 72-year-old male patient with diabetic nephropathy developed irreversible acute renal failure and became dialysis dependent. Why, you may ask? Because he was prescribed an innovative, at the time, diagnostic procedure. He underwent an intravenous pyelography procedure with a new generation iso-osmolar contrast medium, which is a fancy way to say X-ray with contrast. But for some reason, an inexplicably large dose of contrast medium was used. This caused an irreversible damage to his kidneys and a persistent acute renal failure that required hospitalization and dialysis. He never recovered and was bound to dialysis for life. Now, you may think that this doesn't happen anymore today. Well, unfortunately, contrast-induced nephropathy is still a serious danger for CKD patients. Diagnostic tests such as MRIs or magnetic resonance imaging, CT scans and angiograms with contrast are routinely used today. So, question, what should you do if you are prescribed a test with contrast? Talk to your doctor. Make sure they know what your kidney function is. Alright? Ask if the test is 100% needed. And also keep in mind that there are ways to reduce the risk. The minimum amount possible of contrast medium is supposed to be used, and the patient is also supposed to drink a lot of water during the whole procedure. I'm talking about various liters of water. And yeah, your doctor is supposed to know all about that. Up next, something else your doctor is supposed to know all about. Number 2, prescribing medications that damage the kidneys. Medication administration errors are one of the most common forms of medical malpractice. This kind of error is especially dangerous when the patient has kidney disease because there are several medications that do cause damage to the kidneys. Antibiotics are a clear example. Again, doctors should know that prescribing an antibiotic course to a kidney patient comes with several challenges. They should be careful when finding the right antibiotic and the right course because kidney damage is almost always a side effect. Same for proton pump inhibitors, or PPIs in short, that are used to treat acid reflux and heartburn. Some names are Prilosec, Acifix, Nexium, and others. These have been shown to raise the risk for kidney disease if taken for extended periods of time. If you need to take them regularly, ask your doctor if you can switch to H2 blockers like Zantac or Pepcid, as they are less likely to damage the kidneys. Cholesterol medications, or statins, also have some potential side effects for people with kidney disease. More about this in a moment. Now, the most dangerous medications, at least in terms of number of people affected, are NSAIDs: ibuprofen, naproxen, aspirin, and many others. Naproxen in particular is what caused kidney failure in the 42-year-old veteran I mentioned at the beginning of the video. He was given a prescription for naproxen for 3 years, even if he was already diagnosed with kidney disease. Now question, what should have they given instead of naproxen? Now, this is a difficult question to answer. There is a dangerous myth floating around these days that Tylenol or paracetamol is perfectly safe for people with kidney disease. So yeah, one may think that they should have given that poor veteran paracetamol instead, right? Well, paracetamol, also known as acetaminophen, is not actually 100% safe for CKD patients. It can still cause kidney damage, says a recent review of studies. It's safer than NSAIDs, okay, that's true. It's also the favorite choice of kidney patients usually. So yeah, paracetamol is better than NSAIDs, but you should still be careful if you need to use it for extended periods of time. Now, part of the reason why the 42-year-old veteran was given a record settlement of $10.5 million is the result of his first diagnosis back in 2012. Let's take a look at this newspaper because this is another very important lesson for us. Okay, this is another very common and very dangerous error many doctors do. As we can read here, Rosignol, the patient, was not just prescribed a medicine that destroyed his kidneys. Even worse, he was never told that he had kidney problems, even if there were medical records dated back to 2012 saying that his levels were not normal. Now here is the problem. His lawyer says that this 42-year-old veteran will not have required dialysis for at least another 20 to 30 years if he was treated adequately. But he was never treated. He was never given a fighting chance against kidney disease, and he ended up in dialysis in 2019 due to not just one but 2 serious medical errors. So yeah, if you would ask me, what's worse than giving someone a medication that damages the kidneys? I would answer that not telling them about kidney disease is worse. Not giving a patient the chance to improve is worse. So yes, this article really shows us how important it is to get informed. Now, I want to circle back to the medication for a moment because there is another hidden danger I want you to know about. Because I bet that many of you guys already know that certain medications damage the kidneys. But did you know that there are supposedly safe medications that actually deplete essential nutrients? Yeah, so why is this dangerous? Well, as we can see from this list, which is not complete, by the way, there are common medications that deplete vitamin D, for example. Corticosteroids, primidone, but also some cholesterol-lowering drugs, laxatives in general, and even some blood pressure medications such as spironolactone and nifedipine can cause your vitamin D levels to go down. And that will be a serious problem because vitamin D deficiency is linked to faster kidney function decline and kidney damage. Very dangerous. But as we can tell from this list, there are many prescriptions that can cause vitamins levels to go down. And don't think even for a second that having low levels of any of these vitamins is not dangerous. For example, a B12 deficiency may cause anemia, a cause of kidney damage. So yeah, you absolutely don't want to be deficient in vitamin B12. But as we can see here, metformin, which is a first-line treatment for diabetes, can cause vitamin B12 depletion. But how many doctors do prescribe regular tests for vitamin deficiencies when prescribing these medicines? Now, as I was saying, I wanted to circle back to statins. Statins have some not so pleasant side effects, and they are also linked to CoQ10 deficiency, which can also make statin side effects worse. Muscle pain in particular. If you follow me here regularly, you probably already know how important CoQ10 is. It was even used in dialysis patients as a way to actually get them to stop dialysis. Yeah, it's incredible. Watch that video if you missed it, by the way. It's up here. So, CoQ10 is clearly something you don't want to be deficient in. But not many doctors will tell you to supplement CoQ10 when taking a statin. What to do then? Clearly, getting informed. Another thing I always suggest is to double check the leaflet for any medication you may be taking, especially if you get prescribed something new. See what the common side effects are. And most importantly, number 5, make sure you are not victim of interactions. Drug interactions represent probably the biggest danger lurking out there when it comes to medications. The combination of NSAIDs, diuretics, and ACE inhibitors is the perfect example of this danger. They are relatively safe if taken alone. Well, except for NSAIDs, but when mixed together, they can send you straight to the emergency room. This is called the triple whammy, and it's incredibly dangerous. And I know that there are professional figures whose entire job revolves around double-checking that patients aren't mixing prescriptions that shouldn't be mixed together. I mean, a huge part of the job of doctors and pharmacists is to double-check this. But I will still recommend you to always double-check that everything you take is safe and free from interactions every time you have a new prescription. Google is your friend. And keep in mind that you can always consult your doctor if you have doubts. So that's the lesson here. Get informed about anything you take. Talk to your doctor and ask questions. Now guys, I've talked more about what can happen when someone takes 2 or more prescriptions that should have never been given together in my video up here. Watch it now for more, and this is all for today. Thank you for watching. God bless you all. Bye bye.